Hi, I am Medicare Dana, and today I am going to go over Medicare, the Medicare program, an overview for you. It's so important that you understand the program, you know what the program covers, what it doesn't, and what all of your options are before you make this big decision into what is the best plan for you. So I'm going to go ahead and share my screen and go over with you the intimate details of Medicare. Now go ahead and grab a pen and paper, and there's going to be an opportunity here where we're going to do a little exercise, but also if you have any questions as I go through, write them down, email me, call me, happy to answer any questions for you. So you have two main ways to get Medicare coverage. You can get it through Original Medicare, which consists of Part A, Part B, Part D, and then an optional supplement plan, or Medicare Advantage, which is Part C, that combines Part A and B, and usually Part D as well. And we're going to go over what all those parts are specifically. But this kind of tricks people up. So there are two options. One route is Original Medicare with the supplement. One route is Medicare Advantage. They are different programs with some different rules and different benefits and coverages. So important to know two different options. We'll go into what they each are. Original Medicare is going to be nationwide coverage. So we're all really used to group or independent insurance policies with in-network, out-of-network type of situations. What you've bought into in terms of what you've paid into for Medicare is this option for freedom of choice. So that is nationwide coverage across the board, accepted by 96% of doctors and facilities. Original Medicare is the most widely accepted insurance program. So basically, you really have a choice across the board of who to see. You choose your doctors. There's no pre-authorizations or referrals. You choose your facility and you choose your hospital. So it's really you managing your own care and being able to go to whatever doctor specialist you might need. It's guaranteed renewable as long as you're paying your premiums. You will always be renewable, and you can change at any time. There are no lock-in times or periods. With Medicare Advantage, it varies from county to county, so it's a little bit more restrictive in both the state but also in the providers. So it's in-network only. There are some PPOs, but still within a PPO, you've got more of a restriction of in-network versus out-of-network. You do need referrals and pre-authorizations, and the co-payments and out-of-pocket expenses can tend to be a bit higher, especially if you have some medical ailments. Doctors can leave the network at any time. The hospital may leave, or the plan can be canceled, and it is not guaranteed renewable. With Medicare Advantage, there are lock-in periods one time a year that you can make a change if you do not like the plan that you're in. The four specific parts that we're going to now dive into a little bit deeper are hospital coverage, which is your Part A, doctor coverage, which is your Part B, Medicare Advantage, which is that Part C, and your prescription drug coverage, which is Part D. With Original Medicare, that is Part A and B together is considered Original Medicare. You have an option to get a supplement plan or a Medigap plan. So go ahead, grab that piece of paper and that pen, and we're going to do a little exercise to show you what Original Medicare covers and what it doesn't. So please draw a line right down the middle of that paper. And on the left-hand side, write in Part A, hospital visits. And underneath that, please write the dollar amount, $1,484. And under that, the word copays. On the right-hand side, go ahead and write Part B, doctors and outpatient visits. Underneath that, the dollar amount, $203. And then underneath that, go ahead and write the percentage, 80%-20%. And we will go into what all of this means. First, let's look at Part A, hospital visits. The Part A insurance covers inpatient only. So when you're admitted, that's in hospital, skilled nursing facility, hospice, and home health care. Important to know, if you are in an emergency room and you're just getting observed and get discharged home, that is not Part A. Part A is just when you're admitted. So going back to our page here, I had you write down a number $1,484. This is going to be your Part A per occurrence deductible, and the per occurrence is with a 60-day benefit period. So you pay $1,484 when you get admitted to the hospital, and then the Medicare covers the rest. For up to 60 days, there is no copays, but then from 60 days to 150 and on, there are copays each day. So that's what you would be responsible for. So that's a $1,484 per occurrence deductible, and then Medicare covers the rest. Now, that was Part A. Part B is going to be everything that falls outside of those hospital visits. So doctors and outpatient visits, anything in a facility. So this is going to be even lab work, ambulance, if you have mental health, physical, speech, language therapy, durable medical equipment, some preventative care, that all falls under Part B. And if we go back to our page, I had you write $203 underneath Part B, outpatient visits. This is going to be your annual deductible. So different from Part A, where it's a per occurrence deductible. With the Part B side, you pay $203 annually, and then Medicare kicks in. Now, Medicare will always cover 80% of your Part B cost, and then you would be responsible for the 20%. So if we look here, there are certain gaps where original Medicare doesn't cover. And while they cover a good portion of the medical and financial needs here, those gaps can be quite costly. You've got the per occurrence deductible on Part A, you've got copays. On the Part B side, you have that $203, and then you have the 20% of whatever the cost of those services are. So what the government decided to do was they decided to offer up a supplement, a secondary insurance that's optional that you can purchase to help cover those gaps in cost that original Medicare has. Now, there's different Medicare supplement types out there. Some of them are more valuable than others because they cover different benefits. Some are less expensive, some more, again, because depending on the benefits that they cover. So it's important to understand what each supplement covers and then be able to take all that information in and then choose wisely what would work best for you and for your needs. Now, the supplements can cover various costs there where original Medicare does not cover. And I wanted to just go over some of the definitions of these words and what they actually truly mean in terms of a cost perspective. So coinsurance is going to be splitting your healthcare costs with a plan on a percentage basis. So in the example that we just talked about, on the Part B side, Medicare covers 80%, you're responsible for 20%. That would be coinsurance. A copayment is going to be a fixed amount you pay when you have a certain service. So for example, lots of people have a copay per doctor visit. So regardless of the cost of the visit or what's happening at the visit, when you go, you have to pay $30 at the beginning. That's called a copayment or a copay. And then the last thing is a deductible. This is going to be a preset amount that you have to pay first before Medicare or other insurance starts to pay. And in the example we just talked about, the deductible on the Part A side would be that per occurrence, $1,484 for the hospital side, and the $203 annual deductible on the Part B side. So the supplement plans are under the exact same umbrella as original Medicare. So there's no networks either. You can go to any doctor, any facility that accepts original Medicare. And as previously discussed, it is the most widely accepted insurance in the United States nationwide. You're guaranteed just like original Medicare as long as you're paying your premiums. These are standardized plans, and I want to pause here and talk about this for a second. It's important to understand this. The supplement plans are standardized. This is part of that federal program. Across the board, no matter what state you're in, if you're in a supplement plan and you have the same lettered plan, so the same type of supplement plan as someone else in a different state, you have the exact same coverage. So the benefit, the coverage, that is not dictated on the insurance company. That is dictated by the federal program. So you're in Texas and you have family in Illinois or Florida, Georgia, and you're all on the same lettered supplement plan, you all have the exact same benefits and coverage, but you might be paying differently based on your zip code and based on which insurance company. So that's really important to know. No referrals needed, just like original Medicare, and you can change your plan at any time. There's no lock-in time periods. Here's a list of the standard supplement policies for 2021. And if you look at the top, you can see that there's some letters that are missing. So in 1965, when Congress came and created this program, there were some differences. For example, they had prescription drug coverage as part of some of the supplements. While now there's a separate standalone Part D as your prescription drug coverage. So they had to remove some of those options here so that there weren't any kind of crossovers and doubling up of the same benefits. And then there's some other supplement policies that have changed over the years and are no longer available. So that's why you don't have every alphabet letter here presented. But if we look here, we'll see that F and G have the most boxes in there covered. These boxes that are in there that are covered are basically the gaps, the coverage that they provide with the supplement plan. And F and G have the most checked, except G is missing one little spot there. The G plan does not cover that $203 annual deductible. And unfortunately, for anyone who has turned 65 after January 1st, 2020, that F plan is no longer available for purchase. So the F plan covers every gap. The G plan covers every gap except that Part B annual deductible. So otherwise, they're the same coverage. They're the two most comprehensive supplement policies that you can purchase. So if we go back to our exercise here, if you get, for example, the G plan, you're 100% covered on the gaps that original Medicare has in terms of the cost share. The G plan will cover that per occurrence deductible. It covers those copays. On the Part B side, Medicare already covers 80%, but you're then responsible for that 20. The G plan covers the 20, and basically your max out of pocket is going to be that $203. And once you pay that, you've no other expenses to pay. There's no copays, there's no coinsurance, there's no deductible. So if you go back to the supplement chart, you can see that different supplements offer different coverages, but F and G are going to be the most comprehensive, and G, of course, is going to be covering them all except for that Part B annual deductible. So the last part of original Medicare is going to be your prescription drug plan. Now, this is a standalone coverage. It's not included in original Medicare supplement. It's something that you need to purchase additionally. It helps cover the cost of outpatient drugs. It is run by Medicare-approved private insurance companies, so it's still under the program of original Medicare. Now, you must be enrolled in a credible prescription drug coverage or get penalized. So this is sometimes frustrating for some people to understand, but Medicare penalizes you if you don't have creditable coverage. Now, very similar to original Medicare and a supplement, the prescription drug plan is customizable. There are 35 different prescription drug plans out there. And the idea is that you want to find a plan that's going to fit your medication needs and going to be most cost effective for the types of medications that you're taking. The prescription drug plans have formularies, which is basically a list of medications that the drug companies cover. And drugs are divided in tiers. There's tier 1 to tier 6. The higher the tier, typically the more expensive that drug is. So someone who is taking a lot of higher tier drugs, that's going to be on a lot of higher expensive drugs or more expensive drugs, are going to want a prescription drug plan that's going to tailor to those type of medications so that they're spending as least amount of money as possible. And someone who has lower tier drugs is then, of course, going to want a drug plan that's going to tailor to their needs, which is why it's really nice that you have that opportunity to choose the different plans and make sure that you're getting the most cost effective for your needs. Now, Part C is the Medicare Advantage program. Now, this is a substitute for original Medicare, so you opt out of that federal program, and it's private and companies that have contracted with the federal government They are supposed to cover the same benefits of Part A and B, but they've got different set of rules. They've got different charges that you get charged, out-of-pocket costs, and each year they're renegotiated. They do have talked a little bit more restrictions on who you see, how you see them, and who gets to decide on which plan that is. So that's something to know. It's just a separate program. With the Medicare Advantage plan, they a lot of times bundle your Part D. Some people like that. They don't have to kind of go through and pick which plan that they are on. But the downside to that is that you only get the option of the 1 or 2 drug plans that are bundled with that. And as I had just mentioned, the drug plans are there, and there's multiple different ones. So if you are on a plan that doesn't cover your medications well from a cost perspective, you're kind of out of luck. So if we look at, just generally speaking, the difference between Medicare Advantage and Original Medicare is nationwide coverage versus county specific, a more restricted network. Original Medicare, there's no networks. Medicare Advantage is more restrictive. Original Medicare, you choose your providers, you choose your treatment. Medicare Advantage, the insurance companies are dictating that. Original Medicare is standardized, and Medicare Advantage, the contracts are renegotiated yearly, so their rules change. Original Medicare is guaranteed renewable. Medicare Advantage is not. Original Medicare has medical and financial security. Medicare Advantage has higher out-of-pocket costs. And I'm going to pause here and talk about this for a second. So with Original Medicare and a supplement, that medical and financial security with the supplements, you're capped. You pay your supplement each month. And for example, if you get the G plan, you pay $250 out of pocket. That's it. It's a cap. Whatever happens, hospitalization, specialist treatments, it's covered. Where Medicare Advantage, there is an in-network deductible of $6,700 of this past year that resets each year. And if you see any doctors or have to get any type of treatments out of network, typically you pay for that completely out of pocket. So there's more surprises and you pay more on the back end with Medicare Advantage, where Original Medicare, you might pay a little bit more in the supplement on the front end each month, but then you're capped and there's no need to worry. Flexibility to change plans anytime with Original Medicare, and there is lock-in periods for Medicare Advantage. So that's really the gist of Original Medicare versus Medicare Advantage, and the 2 ways that you can get Medicare, an overview of the program. What I do is I compare all of your options with you, and it's so important to me, as I stated at the beginning, that you understand the program. So not everyone, the G plan is not for everyone. Medicare Advantage is not for everyone. It is so important that you understand what your options are, that we make sure that you understand what the downfall, what the pitfalls, what the benefits of each program are, so that you can make a decision based on your needs. I'm completely unbiased. I'm here to help you make sure that you understand what you're getting into. Medicare can cover you for the rest of your life, so you want to make sure that it's a really good decision now, but also in the future. You don't get car insurance, for example, after you get into a crash. You get it before, preventatively, of course, but a car or auto insurance isn't going to, give you a great offer once you've had the accident. So you want to make sure that you're set up so that in the future, if anything happens, you've got everything taken care of. Our loyalty is you, the clients. It's not insurance companies. I'm an independent broker. I am contracted with many of the major companies out there. It's not about them. It's about you. I shop the market. I give you all the options up front with very transparent conversations about how much each is and where you can save the most amount of money, because this is about you having great coverage, but saving that retirement money. I really, really think that's important. Retirement should be spent doing what you love to do, what you've worked hard to do, and not worrying about medical expenses. Knowledge is power. Know the information. Get informed to stay healthy. For any type of education, guidance, questions, clarifications, please give me a call. I am happy to assist. There are more videos and there's more resources on the website. Dig in, take the time, ask questions. I'll leave you here with this last bit of information. Anytime that an agent or an insurance company is talking to you, they should be able to back up what they're saying with Medicare.gov. This is a federal program, and every single thing that anyone is talking to you about should be verifiable. Ask questions. Don't feel pressured. Don't feel like you're asking too many questions if you're confused about something. This is a program that's going to take you hopefully to the rest of your life. And you want to make sure that you know and understand not only what coverage from a medical perspective you're getting, but financially how you can prepare for the future. So ask questions, look, research, do what you need to do. I'm looking forward to helping assist in any way I can.